For a decade, I've relentlessly pursued stem cell procedures to treat whole body osteoarthritis, but now artificial intelligence has brought my pursuit of treatment to an impasse. This is my 2025 stem cell video blog where I document the realities of treating a complex musculoskeletal condition with regenerative medicine. Last year, I was pursuing the PICL procedure, which is a specialized stem cell treatment for the upper cervical spine. But now, the rise of AI has forced me to put my treatment plans on hold, possibly indefinitely. I still need treatment, I know it can work, and I can afford it, but I don't know if I'm ever going to be able to get it again. I have degenerative joint disease in virtually all of my joints and degenerative disc disease throughout my spine. My whole body is ravaged with mild to moderate degeneration. I'm now over 2 years out from my last stem cell procedure, which was in late 2022 in the Cayman Islands and mainly focused on the spine. Most of the treated areas have improved since then, but most other areas, which were not treated, have just stayed the same or gotten worse. And I still wrestle with serious chronic pain every day. My worst pain source is my upper cervical area, and it feels like a locus of pain that's just behind the back of my throat. It radiates through my whole head. This area is serious because a worsening here could threaten my ability to exercise, and in a worst case scenario could lead to an upper cervical fusion, which is a permanent life-altering procedure I could never accept. Another important set of areas are my hands, which flare intermittently based on what I've used them for recently. That joint fragility makes everyday tasks risky. And frankly, all my joints are in various stages of degeneration, and any one of them can flare up at any time. I don't have a single joint in my body I can rely on. My condition very negatively impacts my ability to work. On good days, I do okay, but at least 40% of my work days, I have episodes where the pain hits harder. And that can last from a few hours to the whole day, and it causes a major performance drop. And the arthritis in my fingers is making it difficult to type. My condition also makes it too risky to change jobs, which is a big deal because I need to do that to move my life forward. The other major way I measure my joint health and quality of life is through exercise. Maintaining my strength and metabolic health is crucial, and the only way to do that is through high-intensity strength training. The worst part about my condition is it threatens my ability to do that. At this point, what I'm still able to do is just enough to avoid a complete physical collapse. It's nowhere near ideal. I can only train to about 80% intensity, and I have to avoid a lot of the most important exercises. That severely limits the benefit. I don't know how much longer I can keep doing this or how I'm going to cope when I lose it. And that's what makes treatment so important. Regenerative medicine is the only thing that can preserve my ability to exercise. Without it, my joints will keep getting worse. Even before AI, there were already severe constraints on my treatment opportunities. There had been a decline in my bone marrow stem cell counts, and the bone marrow clinics are the only ones I trust to manage my condition. I want to keep working with them, but the decline in my bone marrow stem cell counts means I won't likely be able to benefit much from their procedures going forward. And in addition to that, I now have caretaking duties that conflict with the recovery from stem cell procedures, and that's out of economic necessity. There's no end to that in sight. And so because of those medical and economic reasons, it was not possible for me to treat all the joints that need it, only a few of the worst ones. 6 months ago, I was pursuing two treatments. The first and most important was the PICL procedure, which is a specialized stem cell treatment for the anterior part of the upper cervical spine. This was a very difficult procedure for me to pursue because of the decline in my bone marrow stem cell counts, but I was determined to do it anyway because it's important. The other treatment was PRP, platelet-rich plasma, particularly for my hands. I've had good results treating my hands in the past with high-dose PRP, although I've not had as good results with it in other areas. Those two treatments made the most sense based on my overall medical and financial circumstances. The medical upside was there. I thought they could make a difference in my overall condition, and I could afford them. I did need other treatments too, but I wasn't actively pursuing them because the medical upside didn't justify the financial risk. I had super realistic expectations. I know from experience that no form of regenerative medicine is curative. For me, it's only a partial improvement. And combined with the difficulty of treating so many areas, there was no treatment I was realistically going to get that was going to come anywhere near restoring me to normalcy. But certain treatments could have helped delay disability for another few years, and that's what I was going for. Treatment also serves a psychological purpose because just knowing that improvement is possible is a form of emotional fuel that keeps me motivated. And so late last year, I was pursuing those two treatments, the PICL and PRP, at least for my hands, and that's when AI brought my treatment opportunities to a screeching halt. If you've been following me for a while, or if you even just knew how much treatment I've had with regenerative medicine, you might wonder what I do for a living that allows me to self-finance so much expensive treatment. You might assume I'm a professional with a high-paying job, but that's not the case. I work Tier 1 customer service in a call center, handling routine tasks. And I've done this job for 10 years because it's the only one I can do. I have low inductive reasoning aptitude. That means I can't solve complex new problems or make decisions quickly. I rely on crystallized knowledge to work. And I do my job very well, but the problem is AI can do it even better. When I first saw AI in late 2022, I immediately knew it was going to take my job one day. But that didn't initially touch my treatment plans because that threat felt distant, and I expected to have to stop working and file a long-term disability insurance claim before that happened. Long-term disability insurance, or LTD, replaces part of your income if you can't work because of a disability. I had anticipated an LTD claim since 2020 when my condition first started going downhill fast, because it was clear I was on a trajectory toward disability, but I pushed myself to keep working as long as possible. And I thought that if I ever lost my job, I could fall back on that LTD claim, because at the time my condition was so bad, I thought I already qualified as disabled. And that maybe was true at the time, but then I got some improvement from my 2022 stem cell procedure, especially in my thoracic spine, and that allowed me to keep working longer than expected. And I started pursuing my next procedure, the PICL. I was trying to do three things at once: work as long as possible, continue to get regenerative medicine procedures, and build a medical record toward an eventual LTD claim. And I knew AI was a threat to my job, but I wasn't focused on that at the time. I was still focused on my condition. But in late 2024, I started to become alarmed at how fast I saw AI advancing everywhere around me. It could now do everything a human customer service agent does. You can talk to it conversationally, it can see what's on your screen, it's integrated into everything, and companies were already rolling out the first AI customer service tools. I was reading all these articles that were coming out last year about the jobs AI is going to automate first, and mine, customer service, is at the very top of every single one. A lot of my peers are in denial about that, but I agree. There's no job more squarely in the path of AI automation than mine. And so at some point late last year, I had seen enough. The writing was on the wall that AI stands to displace my job imminently. So I couldn't treat it as a distant threat anymore and started to become very anxious about my job future. I didn't know if AI was going to take my job in 6 months or 2 years, or even for sure that it was going to happen at all, but it felt like it could happen at any time. And if and when AI takes my job, I'm not just going to be unemployed, I'm going to be permanently unemployable. Because of my aptitude pattern, there's no other job I can retrain for when AI replaces mine. I sure as hell can't do physical labor. As the AI threat started to feel imminent, my mind went straight to long-term disability insurance, because if AI is going to take my job, my only hope to have an income in the future might be that LTD claim. And filing it felt urgent because I have to file while I'm still employed. If I lose my job first, I lose my LTD insurance. And as I focused on the LTD policy, I was hit with another realization, which is that in my current condition, I probably don't meet the LTD definition of disabled. To qualify for LTD, I have to be unable to do my current job. That's the policy standard. Now, clearly I'm disabled by some standard because I work through serious pain, I struggle half the time, and my condition cuts me off from any other job I have the skills to do, but I still don't think that's enough, because despite my condition, I still show up every day and do well enough not to get fired. So I'm caught in this gray area where I am seriously compromised, but still not necessarily disabled enough to deserve disability insurance benefits. And that's when it hit me. To qualify for LTD, I have to let my condition get worse. And that's the exact opposite of what I've always done. But if I get even a little bit better from a regenerative medicine procedure, I could disqualify myself from LTD. And so now there's this conflict where the regenerative medicine procedures I need to preserve my joint health and save exercise are directly at odds with the LTD claim I need to survive financially. The irony is I got my last stem cell procedure in 2022, which I spent $50,000 on because I wanted to preserve my ability to work. But now that same improvement might cost me my income because I won't qualify for LTD in time. At the moment I grasped the conflict between regenerative medicine and long-term disability insurance, I was in the process of moving forward with getting PRP for my hands. I had a consultation set up at one of the local Regenx clinics. But the moment it clicked that getting that treatment could undermine an LTD claim, I immediately canceled the appointment. And I had no hesitation about it. I just canceled it. It was the easiest treatment decision I ever made. And that was the first time in a decade that I actively halted treatment. I had no emotional reaction to that, probably because I already knew my treatment path was coming to an end soon anyway for other reasons. This was just the last straw. I was far more concerned about losing my job, and so I wanted to see if my condition was truly bad enough to deserve LTD. And I tried to intentionally flare my condition by exercising harder. I increased my exercise intensity from 80 to 100%. I did squats, used my grip, trained my neck, everything I don't normally do. And it took a few weeks, but it worked. It increased the pain level to a disabling degree. Okay, now I'm fucked up. But as I did that, what I experienced wasn't just an increase in pain. I could feel a structural breakdown of some of the joints. And I knew that meant that the improvements I got from my 2022 stem cell procedure were starting to come undone. My cervical facets became noticeably stiffer and the degree of crepitus became more pronounced. And that's when I put the brakes on it, because I wasn't willing to sabotage everything I've worked for 10 years and cause permanent joint damage just for the sake of an LTD claim I don't even want to be on. I knew I just had to face the situation no matter how bad it is. So the immediate decision to cancel PRP was clear, but now I'm faced with the long-term consequences of the decision of whether I'm going to continue getting treatment or not. And it's an impossible choice. Pursuing regenerative medicine is my only chance to preserve my ability to work and exercise, but it depletes scarce resources when I'm facing the loss of my only work option, and there's no guarantee or even known likelihood that these procedures will work well or have much of an impact. But to the extent that they do work, they'll undermine my LTD claim. On the other hand, not getting treatment preserves resources and is more supportive of an LTD claim, but then I have to accept the inevitability that my joints are just going to keep getting worse and I'm going to have to eventually stop exercising. That might very well be too hard of a pill for me to swallow. An LTD sucks. It only pays 60% of my pre-disability earnings, and the insurance company will constantly reassess me to try to find a reason to kick me off the claim. So am I really going to trade my only option to save exercise for that? Neither option is acceptable. Continuing to get treatment with regenerative medicine is living very dangerously. Not getting it is the safer option, but that means surrendering a core part of who I am, which is the fight to continue exercising. I don't know what the worst case scenario is. On one hand, I could lose my job and still not qualify for LTD, even if I don't get treatment, and then I'm going to have to strain against overwhelmingly bleak odds to try to find something else I can do for work when I'm already teetering on disabled, and I'll just have to live off savings until they're depleted. That may very well be the most likely outcome for me, and that's exactly what makes it seem too risky to keep spending tens of thousands of dollars a year on regenerative medicine procedures right now. On the other hand, if I don't get treatment, or even if I do get it for that matter, my condition could get a lot worse, and I could be in excruciating pain. That kind of physical catastrophe could be equally devastating. So I'm just sandwiched between getting wiped out physically and getting wiped out financially. What am I going to do? The AI threat has jolted me into action. I'm working as hard as I can, both at my job and outside of it, in the hope my humanity will be able to provide some value somewhere. I'm trying to find something else I can do to make money after AI takes my job. I don't know what that's going to be, and I don't really see anything, but the same aptitude test that once showed low inductive reasoning aptitude also showed a very high score in what they call ideaphoria, which they define as a talent for generating ideas quickly. And based on that, they recommended I pursue a career as a creative specialist communicating about a subject of interest to me. And that's great, but I've never known how to use that. What am I going to communicate about? Regenerative medicine? No, I promise you I'm not. But I have to figure that out starting now. The odds are very against me, and I almost certainly will fail, but I have to go for that faint chance, no matter the odds. The philosopher Leonard Peikoff once said, the worse the coming future, the more it should motivate you. And so that's what I'm doing. I'm trying to find reasons for optimism. Is it possible that something will change my view and make me willing to move forward with treatment again? It's possible. Maybe AI won't take my job. Some people argue that AI will not replace human customer service agents, but rather just augment them. I don't agree with that, but it's possible. Or maybe AI will open up another job I can do that I can't even imagine yet. Or maybe I'll be able to go on LTD and find a way to reconcile that with some limited form of treatment. Or maybe I'll have a financial windfall. All these things seem pretty unlikely, so I don't want to be naive, but they are at least possible. And everything I'm doing is predicated on the goal of clearing the impasse so I can resume getting treatment again one day. So that's the impasse. After a decade of pursuing regenerative medicine treatments, AI has forced me to, for the first time, prioritize financial survival over medical improvement. I've been forced to pivot from getting treatment at any cost to preserving resources, like a normie saving for retirement. And so will this impasse be the final chapter in my regenerative medicine journey, or is it just the latest shit show and a long line of obstacles I have to face along the path to endless treatment? Only time will tell. This is the official BRG stem cell video blog.